Agoraphobia can respond really well to treatment as long as it is agoraphobia that we're looking at. Let's talk about that in more detail. Agoraphobia is best described as feeling anxious or even panicky about situations where I feel like it's not going to be easy to get out. So that might be things like buses or trains or planes, or it might be things like queues or being in a cinema, or just places where I feel like it might be socially awkward for me to just leave. If we're going to try and understand it in more detail, it's helpful to know that the full term is panic disorder with agoraphobia, which is slightly different to panic disorder without agoraphobia. Let's talk about how they both work. Let's talk about panic first. So within panic, usually there is a trigger which is often a physical symptom. So noticing that my heart is pounding, or that my chest feels tight, or that I can't quite catch my breath, and then having a panicky thought about that. So I can't breathe, I'm going to have a heart attack, or I'm going to pass out. Obviously that's a terrifying thought for any brain, and that kicks in your fight or flight response. So your body quite literally then makes your heart pound even faster and makes your breathing even more shallow, because that's what the anxiety response is there to do. It's to help you run away from tigers and stuff. Off goes your heart, faster goes your breathing. That makes you even more convinced that you can't breathe and that you are going to have a heart attack. So that's the first thing, is this little cycle here, just going round and round, ramping it up. So what are you going to do? You're going to escape. Of course you are. Now in pure panic, sometimes what that means is what you end up trying to avoid is things like raising your heart rate at all. So you might avoid exercise, that kind of thing. When it's panic with agoraphobia, usually the main focus is on situations where you feel like you might panic. So the ultimate fear might still be about passing out. So I don't want to get on a bus because what if I get so panicky that I pass out? That's going to make you start avoiding situations where you feel like you can't escape. But sometimes it's not a fear of passing out or having a heart attack. Sometimes the fear is of panicking in itself. What if I have a panic attack and I can't escape? Or what if I have a panic attack and it's embarrassing? So that means I'm stood in a supermarket queue. I start to think, what if I panicked here because I just have to dump my shopping and leave? That's a scary idea. Off goes the adrenaline. I start to panic even more. Off goes my panic. Now it's important to say that there are other reasons why you might get anxious or panicky in crowds or places where you can't escape. If you've been assaulted, for example, you might be really aware of people behind you. That might be best viewed as PTSD, and the treatment approach to that is slightly different. If it is panic with agoraphobia, there are two ways we would look at helping. One is, in the moment, how do you help when you're beginning to have a panic attack? And one thing is kind of getting in there and understanding, this is my body having a response that is perfectly natural and normal. It's scary, but if I can take the reins of my breathing and help myself slow down, perhaps do some grounding techniques, feeling your feet on the floor, looking around, seeing what you can see, smelling what you can smell, taking your mind away from just thinking about the feeling in your chest, that can be really useful to just slow things down. The longer term approach is exposure therapy, and what we mean by that is gradually and gently putting yourself into situations which provoke this feeling and then riding it out for as long as you can. The point of this is the idea that this is such an automatic process that it's not the conscious part of your mind that needs to learn that these symptoms will go away on their own and they're not dangerous. It's actually the automatic part of your mind that needs to learn that. It's almost like taking a dog that's scared of people and gradually letting it be around people so that it can find that, okay, it's all right, I don't need to be afraid of this anymore. That's the way that I would put it. It's not an easy process to put yourself through, it's not a particularly fun one, but it can be really effective and best done gently and with kindness.